everyone, Justin White here, CEO and founder of Senior Health Services. Thank you for watching Medicare Monday, and we're going to talk a little bit about Medicare Dental today. Lots and lots of questions come in. Oh my gosh, they advertise that like crazy. It's a very desired benefit, and we want to make sure that you get the most out of it, and you can, maybe this video will help you recognize a couple of little potholes that some of our clients will run into from time to time, and maybe you can avoid that same thing. Okay, so a couple things that I want to go through. Know what your plan covers. Those plans do not cover everything. Some only cover cleanings. Many of them do have comprehensive things that they cover, but when you go in, the dentist has got to write down and submit what they want to do to the carrier and get approval, and I would make sure that that approval comes back before you let them do the work. I've had a couple of clients recently that the dentist submitted, said, all right, let's get it done. And then they go in and do a bunch of work, and then the carrier comes back and says, yeah, we're gonna approve these things, but not that. And they've already gotten it done, and now they're like, do I pay for this? What do I do? That's just not a good place to be. Okay, so get it approved and then get it done. Also, are you on a plan that it's a zero copay all the way through? Or are you in a plan that's got copays once you get into the comprehensive territory? Very important that you understand that, because I just don't want you to get an unexpected bill. Okay? Finally, you've got to find a dentist that's going to take it. Many private dentists don't take Medicare Dental because they're not happy with the level of reimbursement. Right? These are all businesses. I get it, you get it, we all get it. Okay? We want our dentists. We love our dentists. We want to keep them, but just understand they have to make a living, and so if they're not receiving a certain amount and it's below what they can do, they're not going to take the plan. So some of them will not take the HMO with the lowest reimbursements, but some will take PPOs because they can balance bill if they bill out of network. So you might find a dentist says, no, I don't take HMOs, but I take PPOs, which is fantastic. But that may also mean that you're going to have a balance bill that's going to show up because they need to charge a little more to get them closer to what they typically get when they do that procedure. Okay? This is not an unusual thing. You just need to know. But I'll tell you, probably the main thing, and the one thing that I think agents leave out of this way too much, is that you may have a challenge finding a dentist that's going to take it depending on the plan that you're in. It's not that there's no dentists in there, because there's a lot of dentists here, wherever you are, whether it's Texas or Houston or Dallas or another state or whatever. There's lots of dentists all over the place, but you may have to work a little bit to find one that takes your particular plan. If you have big dental needs that are going to be expensive and your dentist doesn't take it, you might have to consider changing dentists to go get those things so you can unlock the money. The money in those plans is real. Don't get me wrong, it is absolutely real. But you may have to do a little footwork and a little bit of finagling to figure out where you can go and how you can get it done so you can take advantage of all the benefits that are in those particular dental plans. And that is up to and including going to one of the dental franchises or something like that. Some people could care less. Other people don't want to do that at all. But if you want to unlock the benefit that's in there, sometimes you have to. Does that make sense? Those plans are really great and they're very popular, but you have to know how to get the most benefit out of them, and that's what I'm trying to do here. I hope that helps. If you have any questions, let us know. Otherwise, thanks for watching Medicare Monday, and we'll see you next week.